is sponsored by Mercy Health Physician Partners, where they have recently launched a new service, Podiatry. Dr. Courtney Thenn is here to talk about the services she's providing at Mercy Health. Hi, Dr. Thenn, good to see you.
Hi, good to see you as well. Thanks so much for having me.
Glad to, and so pleased to be able to talk about this area of practice. It seems so important. Tell me about some of the services you're providing there.
You know, with podiatry, we can do anything from below the knee down, as mundane as fixing toenail conditions to something as extensive as fracture care or tendonitis or generic foot pain, and also some wound care.
I know that with many of those injuries or challenges that you mentioned, there's some instant gratification for you and for the patient in resolving pain and discomfort.
Absolutely. I think podiatry is a great field where patients come in and they're having some sort of pain, injury issue, and together we kind of work on a solution that seems to fit into the patient's lifestyle and help take care of their pain. A good example would be my elderly patients that have a difficult time trimming their toenails. They come in with long, thick nails, and I'm able to trim them down and get them much more comfortable for the patient.
When you're working on finding a solution to people's pain, I know that you start conservatively. The goal is to begin there and then move towards surgery only if and when it's necessary, right?
Absolutely. Yeah, we always start conservatively and make sure that we take care of all of the conservative issues first, or the issues prior to needing surgery. We never want to jump right into surgery. A lot of times, most of the conditions in the foot and ankle can be resolved with some sort of a discussion about shoe gear or inserts or immobilization to help calm down some of their symptoms. Obviously, that's not always the case, and we do have to talk surgery, but we always like to start conservatively if we can.
I know that foot care is important for diabetic patients. Talk a little bit about how that is so important and so different for folks who have diabetes.
Absolutely. So our diabetic patients sometimes suffer from a condition called peripheral neuropathy, where they don't have the best feeling in their feet. So preventative care is the most important thing that my diabetic patients can do. And that includes checking their feet every day to make sure they have no areas of irritation, blisters, or any sores forming. I also recommend that my diabetic patients wear white socks. So that way at night when they take their sock off, if they notice any blood on it, they can say, oh, wait, I wonder if there's something going on with my foot, to make them kind of more aware of anything that could be going on. We typically see our diabetic patients every other month to do some routine foot care, trim down their nails, check their feet thoroughly, and make sure they're not presenting with any issues.
It's summertime. I know I'm guilty of just throwing on the flip-flops and running to the store, or even wearing them all day long. And I feel it at the end of the day when I've worn a shoe like that. But talk a little bit about how foot care differs here in Michigan from the summer to the winter.
You know, in the summer, we're seeing a lot more of that kind of overall foot pain because patients aren't wearing proper shoes. Like you said, a lot of patients go to their flip-flops because they're easy, and then they have some plantar fasciitis or injuries that kind of pertain to not proper shoe gear. Other things that we're running into in the summer is more foreign bodies. A lot of patients are stepping on something, maybe getting it in their foot, and developing an infection that way.
Where are you going to be practicing? Where are your offices located?
So we have two office locations. One is in Grandville at the Mercy Health Physician Partners office, right off of 44th Street. And then the second office is going to be over on the East Beltline at that Mercy Health facility, as well as I will be spending a day a week in the wound clinic down at the Wegge Center.
Wow, you're going to make tracks between those locations. Well,
absolutely.
Congratulations. It really is wonderful to know that folks who need that kind of care can find it with Mercy Health. And if you'd like to make an appointment with Dr. Thenn, you can see the phone number on the screen. It is 616-685-1200. Call to make that appointment. We'll put all this information on our website, 13onyourside.com. Dr. Thenn, thanks.
Thank you so much.